The South Health Campus will open in several phases beginning in 2012. When it's fully operational in 2013, it will be a full-service hospital with several key differences, starting with the name.
The campus denotes the notion that this is a place where educators and health professionals and patients and families can meet. And they can receive a whole range of services without having to tell their story more than once or go about the city to different locations. It really speaks to a patient and a family and a community focus, and that's what our healthcare system is all about.
The reason why it's called a campus and not a hospital is to really underscore the integration between the clinical facilities as well as our commitment to research and education.
It's a learning institution. It's a learning opportunity for healthcare providers, the patients, the families, and the community as a whole.
Over time, this needs to evolve to be a site where a lot of education takes place, where we're able to look at new technologies and trying new devices, so as a research, innovation, education. So it's more than just a typical hospital.
It really is a jewel in the crown of Alberta in terms of our healthcare facilities, in terms of the quality of the healthcare that we provide to Albertans.
The facility is designed with patient care in mind. Many of the rooms are single rooms, so family members will be able to stay with patients 24 hours a day if they wish.
South Health Campus is about providing new ways of delivering care in Calgary, a more patient-centered approach in terms of providing care for patients.
We want to have them understand that we're most concerned about health, not about illness. We want to get them back to where they're actually able to function in the community.
It is built to the new standards expected for health delivery. One patient per room. The corridors are wide, they are easily accessible, there's lots of light. Every room has access to an outside window. You can see as far south as the eye will carry. I think it is really exciting and will offer much to patients and health professionals.
Impossible to miss at its location on 196th Avenue in Southeast Calgary, the South Health Campus is different in several important ways.
I think the South Health Campus in my mind is a place of innovation. It's a place that's forward-looking. It's a place where we can experiment with different staffing models, different technologies, and a place of basically that supports the cradle of delivering care.
Patient-centered care truly means putting the patient at the center of the discussion. For the acute care beds, over 90% of them are private rooms. Those private rooms encompass a place for a family member to actually stay with the patient. It brings a recognition that each of the family members are an important team member that needs to be paid attention to.
We will be offering single-room maternity care. What this means is that patients will labor, deliver, recover, and have their postpartum experience in the same room, with care being provided by one nurse.
The campus will serve Calgary and the surrounding rural areas. It is also designed as a referral center for Southern Alberta.
The South Health Campus isn't a replacement facility. The South Health Campus is all about being prepared for the current capacity, the growth that's occurred in Calgary, but also being ready for the future.
We receive patients from British Columbia, Southern Alberta, and Western Saskatchewan. There's continued growth in those areas, and we felt that we needed another hospital campus to be able to meet the needs of not only Calgary, but the growing population in the rest of the province and the surrounding areas.
All the changes and ideas are designed to put people first.
I think this project represents the state of the art in what we call patient and family-centered care. Everything in the design, from the room sizes through to the hallways, the configuration of the inpatient and the outpatient side of the building, really speaks to a seamless experience for a patient and a family that's in need of care from our healthcare system.
We'll have a brand new emergency department that will be seeing 40,000 patients a year. We're looking at outpatient facilities that will be brand new for 200,000 patients a year. There'll be 10 ORs, there'll be suites for endoscopy, interventional radiology, and the latest in terms of design, in terms of patient care, in terms of inpatient care.
When you see the quality of this facility and what it's going to mean for generations to come, we're not just investing in healthcare in 2010 or 11. This is about healthcare for Albertans and access to quality healthcare for generations to come.